The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh, and today we're delighted to have Patty Barnes with us. Welcome, Patty.
Thank you, Don.
Now, you're a certified professional midwife, and you've delivered now over, what, 750 babies, you told me? And you've been at this for how long?
About 15 years now.
You work as part of a team, I understand.
We have wonderful doctor backup.
Okay, so you work with the area hospital and physicians there. And today we're going to be talking about having babies and different things. What's one of the most important needs you see when you work with people that are going to have a baby?
I see a very important need by needing prenatal care.
Okay, prenatal care, and that's what we're going to talk about today.
Yes.
Prenatal care. What is that? What does that mean when you talk about prenatal care?
Prenatal care is caring for the mother and baby in a way to help promote good and physical and mental health from conception to birth, and that's around 38 to 40 weeks gestation.
So how often do you meet with them, and what are you talking about with mothers before they have their baby?
Well, we meet with them about once a month, and then around 7 months we'll see them every 2 weeks, and then the last month of pregnancy we'll see them once a week.
Do you want the dads to come in too?
Yes, we try to get the fathers involved.
And what do you say to them when they come in?
Well, they usually have a lot of questions, and so I would think the big portion of it is educating them as well.
You know, my wife's pregnant, and so we went in to see the doctor and different things, and it was kind of unusual for me to sit there in the waiting room with 40 or 50 pregnant ladies, and they kind of looked at me like I was a sore thumb, that maybe I shouldn't be there. Some of them looked angry at me, actually.
Oh, really?
Not angry, you know, sort of like, why did you get us into this kind of problem or whatever. But so 38 to 40 weeks. So you said, what, once every week after 7 months?
Well, the last month of pregnancy, we encourage them to come once a week for prenatal visits. Unless there's, you know, if we see a problem, we would see them more often.
Well, what if someone says, well, this sounds interesting, but it doesn't seem that important? Why is it so important, or is it?
It's very important because during prenatal care, you could rule out high-risk situations that possibly could be turned around or refer high-risk conditions to obstetrical care. And it's very important that during the prenatal period that we could figure out what person would be in that category of high risk, because it could endanger the mother and the baby.
Do they run tests? Do they do different things during that time? Yes,
there's, well, for example, when a pregnant lady comes in to see me, and we you know, they start off doing their blood work and urinalysis and
those
check their weight,
and
different kinds of things.
I think that you have a graphic about some of the things that you do on prenatal care, and we can look at that. But what are the things that we're looking for then?
Okay, we check weight at each visit to make sure that her weight gain is appropriate. And we check her blood pressure and her pulse, because we need to know the baseline, what her blood pressure normally is.
What it normally runs, how fast it is, so that when they have
if there's
the baby,
a problem, that we would know about it. We check for edema, any swelling, and we do a chem strip urinalysis to check their urine to make sure that there's no abnormalities or anything that would be a problem in the urine. And of course, we palpate the baby. We check for kicking and fetal movement, and because we wanted to determine how much the baby's moving. And also, we check the uterus size, and we check the uterus size by measuring the fundal height. The fundus is the top of the uterus.
Mm-hmm.
Okay.
So see how tall it's getting, so to speak.
Right, how
All
big the baby's growing.
Okay.
For example, if she's 28 weeks in gestation, then she'd be measuring around 28 centimeters.
So gestation, that means what?
There's 28 weeks pregnant.
28 weeks pregnant, then they measure,
Right.
and it should be about that.
Around 27, 28
Okay.
centimeters. Also, we palpate the baby, so the palpation determines the position.
Palpation, is this a fancy word for you feel where it is?
Yes, feeling the baby through the uterine wall.
Okay, and then you figure out what. I noticed that's kind of an acronym. Checkup, is that right?
Yes,
And that's how you remember it.
yes.
So if you're watching, you write down that word checkup. By the way, I think you recently have written a book about all this, haven't you? Kind of putting those practical things down here. I have a copy of it, The Ministry of Midwifery, and you have a whole section on prenatal care in that book.
Yes.
Looks excellent. I saw that little checkup as I was looking through the material here. Well, you mentioned one thing on that graphic that we just looked at, checkup, weight. And I think you want to elaborate a little bit on that. Why are we so worried about weight?
Well, weight is, I think, is important for the mother to watch her weight. But if she's on a good diet and has a healthy lifestyle, she doesn't need to be concerned all that much or worried about it. But there is a normal weight gain. It's around between 20 and 25 pounds.
All right.
The weight gain is coming from the amniotic fluid or the water. It's 1.5 to 2 pounds. And then we have extra mass, 4 to 9 pounds. Increased blood and fluid, body fluid, about 4 to 8 pounds.
That's the blood of the mother and the fetus together, right? Okay.
And growth of the uterus, around 2 to 3 pounds. So this is just an average. Her placenta, 1.5 to 2 pounds, sometimes less. And the baby, 7 to 8 pounds. Of course, we could have 6-pound baby or over 8 pounds. But the average weight gain is around 20, 25 pounds.
Do some mothers get worried that they're gaining too much weight?
Yes, most of the clients that come to me, they know that I'm going to help them by encouraging them on a good diet, a good lifestyle, and exercise.
What about those mothers that are real nauseous during the first part of their pregnancy and they're not able to eat too much? What do you do with them? What are some practical things you do with them?
Well, it's amazing how much just by drinking a lot of water it helps. I find that if they're well hydrated, they will have less nausea.
So drink more water if you're nauseous.
And get exercise. But there is a natural remedy that I find, it helps me when I travel, when I go on airplane flights, is ginger root.
Ginger root. That's not going to harm the baby?
No. Oh, no. It's medicinal.
All right. So that helps with nausea?
Yes.
All right. So ginger root and more water and drink water all day.
Well, we recommend about 6 to 8 glasses a day.
6 to 8 glasses, which is, that's what they say for normal people, too, to drink 6 to 8 glasses, right?
And just sipping on peppermint tea.
Peppermint tea.
That's an antiemetic. It relieves nausea.
Okay. Great. Well, anything else for those prenatal moms that are, wondering what they should be worried with? We've talked about weight. We've talked. Well, wait. Back to this weight thing. What's too little weight? When do you start to get worried? Do you ever get worried when someone doesn't gain? Does anyone have a baby that doesn't gain, that much weight?
Well, yes. It would probably be smokers.
Okay.
And
that's something to worry about then,
yes,
isn't it?
I would consider, I would classify them as a high-risk situation. But I wouldn't recommend fasting because I feel like the baby needs 3 meals a day and the mother.
Okay. So
But you can tell, you know, how well the baby's growing by prenatal visits, you know, like I said, measuring the fetal heart. Measuring the uterus, the fundus, and palpating the baby.
Mm-hmm. So you said that a baby is there for what, 38, 40 weeks for pregnancy, is that right?
Usually it's from conception to birth, it's 38 to 40 weeks, sometimes 42 weeks.
What about, you know, the first 10 weeks? What's happening with the baby? What's developing, and what can the mom do or not do that's going to help that be good or not good?
Well, around 8 weeks,
Mm-hmm.
most of the pregnant moms don't even realize they're pregnant, and that is the most critical time.
8 weeks is the most critical time.
It's when the cells are rapidly dividing.
Mm-hmm.
And they need to be very careful around teratogens, which would be x-rays, drugs, fumes.
All those different things.
Mm-hmm.
Fumes, any kind of fumes, carbon monoxide, all that different
Paint.
Paint, no paint. But later on, that's okay?
Well, I would say you just want to, if you're doing any painting, you would want it to be well ventilated.
Well ventilated. So why is that so important? What's happening around 8 or 10 weeks with the baby? That's all dividing, but what's really...
As the baby's developing very rapidly, and you just need to concentrate on eating healthy and making sure that nothing goes into your body that would be damaging.
So this idea of having cravings and different things when you're pregnant, do you have to just rise above that and say, I'm not going to eat that even though I feel like it?
Yes, you cannot trust your cravings. Pickles and ice cream.
Pickles and ice cream. Well, you hear that a lot?
Well, no, not really. But most of the people that come to me are really, they want me to encourage them on a healthy diet.
Mm-hmm. So instead of the water, instead of the ice cream, we should have water or something like that. What's so important about water?
The reason why they need to drink so much water, and we encourage hydration, is because the amniotic fluid that's surrounding the baby is reproduced every 3 hours.
So they change the water in that little swimming pool for the little guy or gal every 3 hours?
Yes, at least 30% of it. But I can tell you there's around, we're talking around 1,000 mils of fluid that's surrounding the baby, and that's the protection for the baby, the amniotic fluid.
Mm-hmm. That's the bumper.
Yes, protects the cord from being compressed, and the baby can move all different positions and still be protected.
Mm-hmm. So you don't want them swimming in ice cream and pickles.
No.
You want water.
Water.
We've been talking with Patty Barnes. She is a certified professional midwife, delivered over 750 babies. Maybe you're pregnant or know someone who is. Call them up. Join us when we come back, and we're going to talk more about what we need to be looking at and being aware of before we have a baby. Join us.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Deal and Dr. Eileen Luddington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Luddington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We're talking with Patty Barnes. She's a certified professional midwife, and we've been gaining from your information. You've delivered now over 750 babies, and when we were talking before the break, we were speaking about prenatal care. It's really important to have that, to be involved in talking with people that have seen so many babies. Education is very important. Do you do a lot of education when you're in the homes?
Yes, we educate the mother and the father for labor and delivery, and of course we want the fathers to encourage their wives in obtaining good prenatal care, and eating right, and exercising. And
I was looking at the section on prenatal care here in your book, and one thing that I noticed was that you spent considerable time talking about a urinalysis, or mentioning that. Well, what's important about getting the urine tested for a mom that's expecting?
Urinalysis can reveal a lot of things, but we mainly concentrate on, for example, like protein in the urine. If she's spilling protein, we want to make sure that she's eating enough protein for the baby. And
what are some good sources of protein?
well, we have a food chart. We're going to talk about that.
Okay.
And also leukocytes, which would be to rule out infections.
White blood cells.
Right, white blood cells.
The fighters, yeah, okay.
And if it's if you're showing leukocytes with nitrates or nitrites, then you could possibly be fighting bladder infection or UTI, urinary tract infection.
So can you give antibiotics during that for pregnancy? What do you do?
Well, the doctors will, usually prescribe.
Take care of that.
Yeah.
Do something. Cranberry juice work for that?
Cranberry juice, and we encourage drinking a lot of water.
A lot of water. Can't go wrong there.
No, you can't go wrong there. And also we check for glucose, because we want to rule out gestational diabetes. And
Gestational diabetes, that means diabetes during
pregnancy.
Now, if someone has gestational diabetes, then what do you do as a nurse midwife? I know you got the physician working with you and different things, but what do you do as a midwife with that?
Well, if they are spilling sugar in their urine, we first we go over their diet and make sure that it's just maybe they had too much sugar that day or something, and we would try to correct it with their diet. If not, then of course they would be referred to obstetrical care, where they would do other things to rule out any problems.
Before we went to the break, you were talking about that list of things, checkup, and one of the things there was edema. What is edema? Why is it on your list? What's that got to do with?
Well, edema just simply means swelling. And we have dietary eliminations for edema, like the restriction of pork, because we find that pork is a very big irritant for fatty, salty, and has other harmful things in it that could encourage edema, cause a rise of hypertension and, or high blood pressure.
So out of meats, if they're going to eat any meats, one that especially avoids pork.
Yes, especially to avoid pork, because I find that's the biggest offender of edema. Also, caffeine and other stimulants could encourage edema. Fried fatty foods, any spicy foods, and sugar. Also, we try to encourage them to eat plenty of fresh fruits and vegetables to get a proper protein balance, and replace lemon in the place of vinegar, because vinegar is an irritant. And fresh lemon cleanses the blood. Garlic, parsley, onions, and cucumbers is very good for edema. It's a blood cleanser. And
garlic.
You're going to hear me say lots of water through this whole thing.
Lots of water and garlic. My wife's going to love that. She loves garlic. Anything else?
Of getting fresh outdoor exercise, and but usually, honestly, Don, I hardly have any problem with any of my pregnant ladies having edema.
Is that right?
I might have just toward the hot summer months, we might see a little bit, but as far as edema because of hypertension or health reasons, I hardly have that, because most of the pregnant ladies that come to me, they know that I'm going to encourage them in a good diet and lifestyle. So I really find that.
So what is the problem, though, with edema? What is the problem with swelling? I mean, what's the big deal? So what if your ankles get a little bigger and your appendages?
Well, if it's coupled with, if you have swelling and high blood pressure, blurred vision, headaches, and you're getting signs of preeclampsia or toxemia.
Okay, preeclampsia, what's that mean?
That would be before, that's preeclamptic is toxemia simply just means poison in the blood.
Okay.
And you could cause problems as to prematurely separate the placenta if the blood pressure gets too high, and cut off oxygen supply to the baby.
So this is a big thing to worry about if you start to see swelling or different
Yes.
things. You don't want that happening.
Yeah,
You
and
don't want that going on. What about, well, how does, you mentioned fried and fatty foods. I mean, what does that mean? How does that work?
Well, fried fatty foods, of course, raises your cholesterol level, and it's clogs up your blood vessels, which will cause a rise of your blood pressure.
When you say spicy foods, what do you mean by that? Like what kind of?
Hot pepper, just spicy foods like hot sauce.
You want to avoid those kind of things.
Yeah.
All right. Well, and then fresh fruits, veggies, all that type of thing.
We can't go wrong encouraging them in a fresh fruit and a lot of vegetables.
You know, in your book, you mentioned as well that that you want to palpate or check the belly of the lady. I noticed you brought a belly here, and you want to show us something about that. Should I hold the belly?
Sure.
Okay. Let me just look at this here. What do you do then? Okay, I assume that this is. Do I have this the right way?
Yes.
All right. And this must be the belly button.
Yes.
It's actually a real button too, isn't it?
It's a real button.
That's an outie, not an innie. So what is it that you do here when you palpate?
When we palpate the baby, we are determining what position the baby is in, and what we're looking for is this baby to be in a head down position or a vertex. It's called vertex position, where the baby's head down. This baby is head down. The head's right here, and I feel the back on this side. So.
And then where are the legs? The legs are. Oh, you can kind of feel it.
Yeah.
Is it this easy on a real lady?
No.
Because
well, it's different, because this isn't a real lady.
Okay.
And the bottom's up here, and but well, there's you're feeling through amniotic fluid, and we do have some amniotic fluid under here, but
well, you're going to open this up in a minute and show me, right?
Yeah, I'll show you.
So then, what do you do? How do you check? You had talked about checking the fundus height.
Yes, I'll show you. We start at the symphysis pubis, the top of the pubic bone.
Okay, pubic bone. All right.
And we measure centimeters.
Centimeters. Okay.
And we go up to the top of the uterus. Remember, I told you top of the uterus is a fundus.
A fundus.
And we see, how many centimeters do you see there?
40.
Wow, she's ready to deliver.
Wow. Yikes. Not on the show, please. Okay.
So she's full term.
All right.
And also by determining the position of this baby, we can feel that the back is over here. So we would listen over here for the fetal heart tones.
And I noticed you have what would you call it? A stethoscope or a fetoscope?
This is a fetoscope.
And you put this put this back over there.
Right.
And what did you do? Put your head on that or something?
Yes, and then
like
we listen. And we listen for the heart tones. And
I don't suppose I'd hear anything here on this one, though, right?
I don't think so.
Well, now, let's say the head. Let's say the head is up here, right up here, and you've got 40 weeks. You're at 40 weeks, and it's time to deliver. What do you do then?
Well, hopefully we would have determined the position before it was 40 weeks.
Okay.
Because you don't want to deliver a breech.
That's what it's called, a breech, if the
yes.
legs are coming out, feet are coming out first. Can you make it turn around?
Well, I was going to say my backup doctors do what they call an external version, and that's done under an ultrasound.
Oh, I see.
And so, but usually
they can kind of move it around sometimes.
Yes, externally they would move it head down, but they would like to do that around before 40 weeks, around 37 weeks.
And then they know where the cord is and everything when they do that, or they try
the ultrasound, right?
Excellent. Well, I'm going to put. Do you have anything else you want to show me here? While we have the belly here.
Do you want to show them the inside?
Sure. Yeah. Yeah. I want to see the inside. Why not? Okay. Let's look there. Wow.
Okay.
Deliveries are not this easy, are they?
No.
This must be the what? Amniotic fluid?
That's supposed to be the amniotic fluid in the baby.
All right. And then
Okay.
let's put that over there. And this is the baby right there.
Mm-hmm.
Yeah, he looks kind of flexible too. Good. Okay. All right. Well, you know, as you're dealing with moms and you're talking with them, anything else that you like to stress for the first-time mom? What types of things do they ever get anxious as they're coming up to their delivery, and what kind of things do you talk about, and
yes,
why?
There's a lot of concerns for the first-time mom. They need a lot of emotional support, not just from their husbands, but from their families, and we try to inform them as much as possible, especially for the first-time moms. They're called PRIMEPs.
PRIMEPs?
Mm-hmm.
Do you call them that?
No,
No.
just to the doctors. But for the first-time mothers, they really need to be educated, and I really encourage a lot of education so that they know just what's going on, what problems to be aware of, and what to expect, and that pregnancy is not a sickness or disease, and that they can do it. I had a lady come to me, a pregnant mother, who came to me who was not informed. And she told me that her first birth was just a disaster because she just really didn't know what was going on. And when she was doing, when she went into labor and went to the hospital, and it was during transition. That was you're just about finished when you're in transition. You know, your cervix dilates completely. You're just about ready to push the baby out. And she wasn't aware of that. Nobody informed her. And transition is the hardest part of labor.
So she thought, when is this going to end?
And yes, and she just said, I cannot do this anymore. And she said something just clicked in her mind, and she wasn't going to. She was not going to have that baby. She said she decided she was going to just leave. So she ran out of the hospital.
At transition time?
Transition.
Wow.
With 2 doctors and several nurses chasing her.
I imagine.
And she was just about ready to push the baby out.
So it's very important then to let people know what's happening, to educate them. And I suppose you do that with the dads as well.
Yes, we do.
We've been talking with Patty Barnes. She's a certified professional midwife. And we've learned what we need to be saying, what we need to be doing before we have a baby, and what we need to be eating, all of these different things. She's written a new book where all this is summarized. We hope that what you've learned will give you and that new one health for a lifetime.